Tony, how does your price account for this outcomes focus that consumers and executives are looking for, right?
Yeah, we don't. We don't yet. We're into month 5 or 6 of our operation. Our first 2 years pricing cycle will probably be largely determined on the maths of the National Hospital Cost Data Collection. The board, my authority, is interested in moving to a normative pricing model, but we don't have the sophistication to do so yet. All of us agree, staff and authority members agree that we just don't have the sophistication to do it yet. We need to consult our community, our clinicians, around what are the key incentives that we need to drive and how do we measure them and how do we recognise them. And we need to follow the overseas experience with keeping a close eye on the NHS and their best practice pricing by results regime, which is tentative at times in terms of best practice pricing. So we're not ready yet. We are looking to 2 years' time at the earliest, maybe 3 probably, really, to be frank. Included in that approach will need to be some understanding of how outcomes are factored into pricing. We dipped our toe in the water on a quality dimension of pricing in our first publication in January, which is still on our website. There's very little support for that across the nation in any sector. Nearly as popular as my country health plan for South Australia, which John Hill still reminds me is a low point of his career. So it wasn't very well received because we came up with a fairly unidimensional approach. But everyone wants us to explore a quality dimension of pricing. I got a couple of questions from people before the session started around why we pay for complications, for instance, when patients are readmitted. Why is there another case payment for complications? And obviously that needs to be changed in due course, but we don't have the sophistication yet to do it. We don't have industry support to do it. We don't have community support to do it. And we don't have clinician support yet. But we will, over the next 2 to 3 years, build that. And we'll also be working with the Safety and Quality Commission, who've actually got the lead role in this regard. So Deputy Coney and I have just agreed to work together at officer level, and our board chairs have also just agreed to work together. So 2 or 3 years' time, I think we'll develop a more mature, sophisticated system with better data and better industry and community support.